Hello friends, the popularity of hair transplant procedure is increasing day by day. A lot of patients worldwide are getting hair restoration done. So the number of clinics who provide this service is increasing every day. A lot of clinics with a commercial mindset have mushroomed and they claim different things but hardly deliver. So unfortunately, the number of patients who are really not very happy with their hair transplant is also increasing day by day. So in my practice, almost 70% of the cases which I am dealing are like hair transplant failure cases who have already done their hair transplantation somewhere else and they are not happy with their results. What are the things which they don't like about their previous transplants? They are either not happy with the shape of their hairline, it looks too predictable, unnatural, ugly, or else they are really not happy with the density, or their donor area has been almost butchered. So let me explain you with the help of an example. Now this patient is Rohit. Before coming to me, he had undergone hair restoration surgery thrice. 2 times it was an FUE surgery and once it was an FUT surgery. So as you can see, his hairline looks very unnatural. It ends abruptly. The shape is not good. It is too predictable. After 3 surgeries, he got it filled. Initially, he wasn't happy with the density. Now, density looks okay, but the angle of hair, the direction of hair is pathetic. And now he has got some gap behind his transplanted hair, which is quite huge, and he needs to fill it up. And if you look at his donor is like almost devastated. There is hardly anything left on the scalp. In my previous videos, I have raised this question. I have explained this many a times that if we do FUE surgery twice or thrice from the same donor area, the donor area is like almost demolished and we don't get that good grafts, that many grafts. The graft wastage is too high. So when I see these patients, when I counsel them, when I ask them why did you choose a particular method or why did you choose a particular clinic, and do you know before the transplantation procedure or after it that you'll have to maintain, you'll have to do medications in order to sustain your hair, even the transplanted ones? So most of them are not aware of these facts. Forget about the methods of transplant and other things. They don't even know about the medications. So that's not good. So in Rohit's case, he got his surgery done twice from a clinic which is not run by doctors, and such clinics are obviously run for profit. And we cannot expect commitment and transparency and the artistic skills from such clinics. It is really unimaginable for them to deliver all this. And third time he got his surgery done from a clinic which was run by a doctor, but the clinic has multiple branches all over India. Now if a clinic has multiple branches all over, no doubt you will find it convenient to have a center near your place. Will that clinic be able to deliver the same kind of results with consistency if they have so many branches? It is not possible. Probably you are not the clinic's priority. So now we had this challenge because he had a lot of scarring in this area. Hairline was too predictable to be acceptable, so we had to extract some grafts from that portion in the frontal hairline and reuse it his donor was already exhausted. So I have been dealing with such cases, and from my experience I'll tell you, these cases are difficult, because if somebody has invested a lot of time, energy, research, money and hopes into a particular procedure, and when it doesn't turn out the way he wanted it to be, then it is really very, very disheartening. And the person is like, his hopes are shattered and he loses faith in the transplant procedure and even the doctor fraternity. Now, to boost their morale up and to encourage them, and obviously the technical aspects of repair surgeries are there, it is difficult. So we have to be very passionate, and we have to work with a lot of compassion and understanding in order to bring that patient from that position to a position of hope. So we did this surgery for him. We took out 1500 grafts by FUE method from the beard. Now, ideally in such cases where already FUE has been done, I usually take out FUT, but in his case one FUT was also done and the donor area was damaged, so FUT wasn't possible. So that's again very important, that the clinic which you are going to should be well equipped and should have enough experience of doing both types of surgeries. It is really very important. Please understand this. Now, we extracted 250 grafts from the hairline and reused these grafts. It's again a very challenging work because the angles are so haphazard and wavered angles. It is difficult. It requires a lot of skill and patience. If you take a look, like this is around 2.5 months post-op-ic. The area has healed. There are early signs of growth. And now look at his 5 months pictures. It looks amazing. The hairline has come out to be really nice. It looks natural. We created temples. We took out those grafts which were not placed accurately. Now the area behind the hairline is also quite full, and the way grafts were placed, the beard graft and all, they merge very well, and you cannot tell that these are beard grafts, or they don't look out of place. The patient is happy. Now he understands the importance of proper counseling. Now he understands the importance of passion and skills. So a lot of patients who are looking for hair restoration surgery, they sometimes primarily focus on cost and they forget the most important aspect of hair transplant, that is result. You can earn money later on in your life, but you cannot earn your donor. Once your donor is gone, there is no looking back. Please be very careful. On our channel you will find a lot of videos where we talk about different methods, their pros and cons. At least go through them, and it is good to know. Maybe a lot of people think that they know everything. There is still some scope of learning. So please go through the videos, you will learn something good. Final message for patients who have lost hope because of their failure transplants. This is not the end of the world. Still a lot of things can be done. You might have seen my other repair works also. So there are good doctors who can really get you out of the trouble. So all you need is to gather courage and have faith. I have a separate channel on YouTube. The link is given down here. In this channel we talk about life, we talk about different aspects like faith, gratitude. I have made some meditations, maybe you can go through those meditations. They are lovely, they are very powerful and encouraging. So if you like the video, please press the like button. You can subscribe us. You can also follow me on Facebook and Twitter. Love yourself. Stay blessed. Thank you.